Hello, friends. Good evening. I'm Dr. Vinayak Rengan, pediatric surgeon and founder of SearchTest. And today it is with great pleasure I wish to invite two fantastic surgeons to this interview today. One is Dr. Harmanpreet Singh, who has secured rank 2 AML in INIS's minimal access surgery, and his proud mentor, Dr. Prashant Shukla, minimal access surgeon from Delhi. So I'll start with Harman. How does it feel to be on the top?
Extremely delighted, sir. I'm very glad that I have desired of him actually during MBBS. I didn't get during PG. I didn't get, but finally I did it.
So I think it must be a great feeling to join Ames, right?
Very great feeling, sir. Extremely happy for that, and extremely thankful to Surge Test team, sir.
Good, 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 good. So Prashant, let's
Yeah,
come to the mentor. How does it feel to have mentored hundreds of students for minimal access surgery and seeing your hard work come to fruition?
yeah, it's such a great, it's a proud feeling, and I totally give the credit to all the students which prepare so hard. It's not about the course; it's about the students' preparation, which brings such kind of result and makes us proud. So I congratulate Dr. Herman again for his such a wonderful performance, and I wish him all the best for the future.
Thank you, sir. Thank you, sir.
So Harman, tell us a little bit about yourself, where you did your UG, PG, and ultimately why minimal access surgery?
Sir, I did my UG from Government Medical College, Amritsar, sir. Then I did my PG from Government Medical College, Patiala, under Sanjeev sir and Gunji sir. I'm extremely thankful to them also. Then now currently I'm working as an SR under the team of Sumito sir, Amarpreet sir, Mandeep sir, and Manjeet sir.
This is in GMC Patiala itself.
In Amritsar sir.
Amritsar, sorry, yeah, Amritsar.
I'm,
Okay.
I'm extremely thankful to them, sir. Sumito sir, he has given me a lot of holidays for preparation.
Good, 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 good. And so why minimal access surgery?
Sir, I have good exposure in Patiala, sir, in minimal access surgery. Actually, I feel like the people who are good in video games are actually good in minimal access surgery.
Absolutely.
So I get a great chance here in GMC Amritsar in good hands-on in laparoscopic surgery. That helps in building more interest in laparoscopy, sir.
So you used to play video games when you were a kid.
Yes, yes, sir. So I keep on training on Lepro trainer, sir, since my second year of PG.
Good, good, good.
So I'm quite sure I'm straightforward going towards minimal access only, sir.
Good man. I think that's like a fantastic thing, and I genuinely believe that training on the endo trainer builds up a significant amount of reflexes.
Yes, sir.
And the moment you walk into my home in here in Jaipur, the first thing you will see here in the hall next to the TV is the endo trainer. So
Yes, sir.
so I do this thing it. So tell us about your preparation, and I want you to tell us about your journey into minimal access surgery INISS. Like, what are the resources how did SearchTest help you? What are the resources you used? What textbooks did you study? And how did Prashant's guidance help you in this entire process?
Sir, I don't have any idea about search as before December, and I actually search about that some. I have seen your video, sir, on FNB versus minimal access surgery, and when the start of your course for minimal access surgery, then I sir subscribed for that course during December and started preparing for it, sir, in Jan. Then I have given my fellowship entrance test in March. Sir, I got good rank in that. All India rank was 13, sir.
Mm-hmm.
So I have covered almost everything minimal access part from search test, sir. In case of books, I followed, sir, thoroughly. I followed Subsistence textbook and Billion Love, sir.
Makes sense. Makes sense.
Yes, sir.
So, Prashant, you formulated this entire course, right? The question bank is coming up very really soon. You formulated this test and discussion, the video lectures for minimal access surgery. So, how did you frame it, and what was the frame of your mind when you were creating this? What was like your primary intent, and how does this course usually work like?
So, the source of inspiration for this course was the students only. So it was basically from all the doubts they asked me during my tenure at Max Saket. What all the aspirants used to ask me how to prepare, and how what type of questions they faced in exam. This all led to frame this course, and the content of the course is something around the previous year questions, what has been asked in the previous sessions of AIMS or the FET. So it is basically the students which have framed this course, not me, and that is why I believe they are very much happy with the content of this course. And the next thing I wanted to make sure that they are not able to just solve the MCQs which they get in the entrance exam. They are very much comfortable during their tenure, whether it is MCH or FNB, for the minimal access surgery. They will be very much theoretically well settled during their tenure after attending this course. Okay, so I have mostly covered the SAGES manual and the EAES manual, that is the European Association of Endoscopic Surgery manual, and the ELSA manual, that is the Endoscopic and Laparoscopic Surgeons of Asia manual. So these three manuals are basically the three holy Bibles of minimal access surgery, and most of the contents which we discuss in our course are coming through these three books. And you don't need to go through these books if you are attending my course. So I generally tell all the students that you don't need to worry about the minimal access part. Just take care of it in the surgery part.
Absolutely, absolutely. I think it makes a lot of sense, Prashant. And so one thing I have to tell you, Harman, is I know Prashant for a pretty long time. In
Yes.
fact, very early days of Searches when he was a MS General Surgery student at Rajkot, uh, and then he evolved to become a FNB trainee at Max. And now I'm very glad to see Prashant also evolve both as a surgeon, as a human being. And first he was a student and then he became a mentor, now a teacher and formulating his own course. So I think it's been a fantastic journey for Prashant as well. And I'm very happy about the fact that he's able to help students in such a comprehensive manner. And Harman, so just tell us about what is your takeaways from this course, and do you think this course was actually useful for you?
Sir, the course was very helpful, sir. As sir has elaborated that there is the coverage of three books, ages 1, 2, and ELSA manual. Sir, I feel like the sir has covered everything from stages 1 and 2. There is no need to read that book. If you are reading notes of search test, you need not to refer from stages volume 1 and 2. Everything is covered in the notes, sir.
True, 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 true. Hey, I think this entire interview has been very illuminative. I think we all know each other, so that's one thing. But the fact is that, students who are watching this interview um, are actually going to understand that minimal access surgery is now evolving as a solid specialty, because especially since AIMS has taken up this as a major endeavor right now. And also the fact that what we are seeing here right now is that when this course started, there was a lot of skepticism, especially AIMS, MCH minimal access. In fact, I would say that I was one of the early skeptics. I was like, you should choose a specialty, organ-based specialty, and all that sort of stuff. But right now, when I see these surgeons, we have surgeons in my own hometown, Chennai, who are practicing after MCH minimal access surgery, and the kind of work they are able to do, the kind of surgical expertise they bring to the geographical locality where they are practicing, I think that's been amazing, which shows that a structured training program in minimal access surgery is absolutely useful. And the fact which I want to convey to students again and again is that post general surgery, minimal access surgery is like an established fellowship in most Western countries, including the US, where I work with surgeons on a different on some other aspects who are minimal access surgery trained, and I think that minimal access surgery is the future, especially with robotics coming up. What is your take on this, Prashant and Harman?
So I the in the last few decades, what was the practice was that every general surgeon was a laparoscopic surgeon. So there was not a concept of a board certified minimal access surgeon who had some genuine training in this field, and they are performing procedures. So when after completing my tenure at Max, when I see people who are doing similar type of surgeries what I practice, and I really believe there is a lot of difference in their approach and the outcome when a board certified or a properly trained minimal access perform the same procedure other than the procedure performed by a general surgeon who had bits and pieces of minimal access surgery from here and there. So I don't believe this practice gonna stay of being a general surgeon and a laparoscopic surgeon. And in the coming decade, the minimal access surgery would further evolve because this is going to be future because of the robotics.
Absolutely. Absolutely. I think it makes a lot of sense, Prashant. I think you've spoken, good words. So, Harman, I assume that you're going to be joining AIMS Delhi, right?
Yes, sir. Yes, definitely, sir.
I think I love the spirit. I think when I was speaking to Harman before the interview started, I think Harman was very elated about the fact, and the fact that he has been very determined to get into AIMS Delhi. I think that speaks volumes about his commitment. But I would also say that Prashant, who has formulated this course, he came up with the idea of the course. He persuaded me to start this course. He came out with the ideas. In fact, even when I was reluctant, he was the one who kept pushing me. So I think we are seeing the fruits of his hard work come out. So. Um, Harman and Harman is entering into a journey into a structured training, and Prashant has just completed his FNB and will be beginning his practice as an independent surgeon. And I'm just not too old, but just maybe a couple of years older than you guys. But I really wish you all the best, and my blessings and the blessings of the entire Searches team are with both of you guys. And I really wish that you guys bring a lot of laurels to you, your family, and also improve the quality of care in whichever area you're practicing. And I think that's the most important thing, because the outcomes of learning should be rewarded with great outcomes in the patients themselves. So that is the real outcome. It's not just important to learn. And I wish, and I know that you will be great surgeons who will do a lot of good work to the society. Thank you so
Yes.
much, guys.
Thank you.
You
Thank you.
all the very best. Uh, Thank you so much.